Hi everyone. Before we start our discussion, we would like to give you a quick update on our services. Yashoda Hospitals provides the convenience of having online doctor consultations. You can now talk to our doctors across all specialties from the comfort of your home. We also have a free COVID-19 chat option available on our website www.yashodahospitals.com. Let's start our discussion now. On behalf of Yashoda Hospitals, we are happy to connect you with our doctors via Facebook Live. Today's topic is, are heart patients most susceptible to COVID-19? We have Dr. V. Rajasekhar, our senior consultant, interventional cardiologist and electrophysiologist from Yashoda Hospitals, Secunderabad. Doctor, thank you so much for being here.
Thank you. Happy to be here.
Thank you, Doctor. Doctor, COVID-19 is a respiratory infection which is known to cause complications related to heart, such as heart attacks, pericarditis, and arrhythmias. Also, the patients with the pre-existing heart conditions are who recently underwent surgery or device implants are at greater risk. What can patients do to avoid and protect against COVID-19? Let's find out. Doctor, what is the risk from COVID-19 to heart patients?
Heart patients are as much vulnerable to catch the infection of COVID-19 as any other individual. Having said that, once they get the infection with COVID-19, the risk of having a severe disease and complications because of the disease is much higher. In people who have a pre-existing heart or lung disease, when they get a COVID-19 infection, they are more likely to face complications arising out of the disease. So that's why it's very important that we protect and isolate our patients who have heart disease or lung disease, especially if they're older than 60 years. We need to further isolate them and protect them from getting that infection.
Well, Doctor, how are emergency services from heart and stroke patients managed at Yashoda Hospitals?
Yes, during the pandemic, there is an additional challenge on how we treat our regular emergencies, regular cardiac emergencies, like patients who come in with heart attacks, who come in with heart failure, who come in with problems related to their heart rhythm or heart rhythm abnormalities, which we call arrhythmias. Of course, we have a system on which we triage these patients in the emergency room, and we try and maintain adequate social distancing even in our emergency rooms, thereby minimizing the risk of patient-to-patient transmission of infection, even in the busy environment of the emergency room. And having said that, once a patient comes in with a cardiac emergency, say a heart attack or something called unstable angina, these are conditions that require immediate hospitalization and immediate initiation of treatment. The treatment could vary from medical treatment, medical stabilization in the intensive coronary care units, or in some situations it may be required for us to take them directly to the cath lab and perform what we call a primary angioplasty. A primary angioplasty is the treatment that we offer to patients who have a heart attack. We do an emergency angiogram and then identify the artery which is blocked, causing the heart attack, and try and open the artery, and if required, put a stent. So that is called primary angioplasty. So it's a very important aspect of our treatment of heart attack, because we need to intervene in these patients in the golden hour. While we are all grappling with the challenges faced because of the pandemic, we must not, let me repeat that, we must not lose our ability to treat heart attacks and other heart emergencies with the same level of promptness and efficiency as we were treating them before the onset of the pandemic. Therefore, we have systems in place where we can isolate and effectively treat each patient independent of the others, and make sure that these heart patients who come in an emergency get timely and effective treatment whenever it is required.
Okay. Doctor, are there designated areas to treat heart attack patients to prevent COVID-19 infection?
Yes, of course. Of course, we have dedicated ICUs. We have got a dedicated channel from admission to the emergency room to the ICUs. And in the cardiac ICU, we maintain optimal patient-patient distance and nurse to uh, patient contact precautions. And all our nursing and medical staff take adequate precautions to prevent patient-to-patient transmission of infection. And these are
Okay.
some of the universal precautions we take in all of our cardiac patients. Uh, and the level of these precautions and the care we take obviously has been augmented several fold against the background of this existing pandemic. And and of course, in cases, there may be overlap that somebody may come in with a heart attack and may actually be having COVID-19. An interesting phenomenon that has been observed all over the world during this pandemic is that a significant percentage of patients with COVID-19 have actually presented with cardiac emergencies, with situations that mimic a heart attack. So they may actually be having a heart attack, but not in the actual sense of a heart attack, because these people have something called myocarditis. It's like an involvement of the heart muscle or an inflammation of the heart muscle because of COVID-19 virus. And this often mimics heart attack in its presentation. It presents like a heart attack, but actually they may not have occluded heart arteries. So whenever there is such a suspicion, especially against a background of a history of fever and cough associated with a history of contact or travel, we have a protocol of scanning these patients with a computed tomography or a CT scan of the chest. And at the same time, we also try and image the coronary arteries by a CT coronary angiogram. There's a quick screening tool which can be accomplished in a matter of a few minutes in our hospital. And once we do that, we actually rule out two things. We rule out if there's a lung involvement because of COVID-19, which is in fact quite a good test with about 70 to 80% sensitivity in picking up COVID-19 infection. Also, the second objective of ruling out blockage in the arteries supplying blood to the heart. Uh, this is also done by means of the CT scan. So therefore, we achieve two objectives with a single test, and that would further enable us to take decisions on which is the best way to treat these patients. And some of these patients who do not have blockages in their arteries because are still present as a heart attack are best treated medically. We treat them with blood thinners and medications and other forms of treatment which are supportive in nature. But those that have blocked arteries require an immediate angiogram and an angioplasty. As I told you earlier, this is called primary angioplasty. So we have specific SOPs and protocols in place to treat these patients with COVID-19 who are presenting with heart-related symptoms or patients who are coming in with pure heart-related emergencies.
Mhm. Doctor, can coronavirus cause heart attacks?
Yes, as I told you, some patients, it's not that they're actually causing heart attacks, but in some patients who have a coronavirus infection are presenting to emergency rooms all over the world with what looks like heart attacks. These are symptoms which are similar to heart attack, and their EKGs or the electrocardiograms are looking similar to those of patients with heart attacks. These are heart attack mimics. Some of them may actually be heart attacks. They may have blockages in their arteries and which have to be treated based on the merits of the case. But others do not have blockages, but they merely have inflammation of the heart muscle. So it's kind of a myocarditis or a myopericarditis that is presenting like a heart attack. And basically, imaging is a key tool imaging in the form of a CT scan is very important in these patients and helps us quickly and rapidly rule out a heart attack in these individuals.
Okay. Doctor, can COVID-19 cause inflammation of heart or pericarditis?
Yes, as I told you, it does cause, uh, in many series that have been reported from all over the world, 20 to 40% of them are actually presenting with inflammation of the heart, which is called myocarditis. And one of the consequences of this myocarditis is inflammation of the covering around the heart called the pericardium, which is called pericarditis. And many of these patients with myocarditis and pericarditis, they actually present with a weakening of the heart function, a condition which we call in medical language as heart failure or congestive heart failure. Typically, these individuals present to us with breathing difficulty, which is indistinguishable from the breathing difficulty due to COVID lung disease. However, there are certain parameters and certain findings on imaging, also certain observations on the echocardiogram and the ECG that help us identify heart disease because of COVID-19 infection. And these are situations where the treatment is to be slightly different compared to the pure lung involvement that we often and more often see in patients with COVID-19 infection.
Okay. Doctor, are there any myths associated to heart patients that they should eat certain food during COVID-19 pandemic?
In terms of food, there are no food restrictions for patients who have contracted COVID-19 infection or who are at risk of getting infection. Practically every one of us is at risk of getting this infection because it's a highly transmissible infection. In patients who have pre-existing heart disease and patients who are elderly and who are more vulnerable uh, for complications due to COVID-19 infection, there is no special food advice apart from what is already advised to them or recommended to them as per their medical condition. Patients with hypertension, that is high blood pressure, need to religiously, rigorously control their blood pressure because high blood pressure is a risk factor for COVID complications. Therefore, they need to have a diet which has been detailed according to their medical condition, which is like a low salt diet and low fat diet, and a diet that is rich in plenty of natural vegetables and fruits, which will not only give them optimal nutrition, but also boost their immunity.
Mhm. Doctor, what are the precautions should be taken by heart patients during this COVID-19 pandemic?
Yes, it's an important question because people who already have existing heart disease uh, are anxious on several fronts. One is, of course, they're anxious they might catch the infection and they may be more vulnerable to the complications due to infection. Secondly, they're anxious because of the kind of prevailing social conditions with the lockdown and restricted movements and transport, etc. They're anxious that they're not able to see their primary physicians or their cardiologists. We try to address each one on its own. First of all, in terms of them protecting themselves from COVID infection, they need to be vigilant. They need to isolate themselves. They need to practice optimal social distancing norms. And they need to sleep well, have their medications regularly, and have a good diet and keep themselves stress free. And they should not default on their medications because it's very important to control their blood pressure or blood sugar, as well as continue all their cardiac medications without any lapse or default.
Okay.
Second thing is, of course, many of them are anxious because they have not been able to make their customary scheduled visits to their cardiologists. For the benefit of all this, we have started a teleconsultation initiative at Yashoda Hospital, which includes a teleconsultation, including a video consult with the patient, where the patient can actually see the doctor and the doctor can see the patient. They can communicate with each other, and the patient can talk freely to the doctor about his symptoms and apprehensions. And we try to allay their apprehensions, and we try to make a preliminary assessment of their medical condition. And wherever they are stable and without any new change in their medical condition, we urge them to continue with their medication. And apart from, of course, boosting their morale and encouraging them to remain confident and positive all through. In those situations where we feel that they probably require some kind of more detailed medical evaluation or some kind of a medical intervention, we do call them over to our emergency services, where we and our team of doctors do a proper evaluation under the best possible isolation precautions, and then tweak their medications or advice accordingly, and in rare cases admit them for medical stabilization, and send them home in a better shape.
Okay. Doctor, what are the treatments available for heart patients during COVID-19 pandemic?
The treatment for heart patients during COVID-19 is no different from treatment of heart patients otherwise. So we treat specific to the problem that they face. Like for regular cardiac emergencies, the treatment is no different. For patients who are coming with heart attack or heart rhythm problems, the drugs, the medications, the procedures more or less remain the same. And as for patients who come in with heart complications because of COVID-19, the treatment so far is largely supportive. In patients coming with heart failure or congestive heart failure, we stabilize them with medication. We have medications to decongest them, to reduce the pressure in their lungs. We have medications that will improve them to breathe better and feel better. And there are quite a lot of medications that can be used to effectively treat patients who have heart complications because of COVID-19 disease.
Mm-hmm.
Unfortunately,
Doctor,
many of them can be treated well. Fortunately, many of them can be treated well, and then they actually go home well. So we need to be optimistic and positive about the whole thing.
Okay. Doctor, how do you healthcare workers protect yourselves from COVID-19 patients?
Well, yes, I think the important thing is as healthcare workers also, we need to absolutely follow all norms of social distancing. We need to maintain patient-to-patient and patient-to-doctor distance without compromising on the medical examination.
Mm-hmm.
And we need to wear a mask, a surgical mask, or an N95 mask wherever appropriate. And we need to don personal protection equipment whenever we do procedures which increase the risk of exposure. And most importantly is that most of us doctors are committed and dedicated to the care of our patients as before during the epidemic, and much more now during the epidemic. And it's important that doctors avoid unnecessary physical contact beyond the limits of their profession, beyond what is required by the demands of their profession. And an appropriate aseptic techniques, appropriate use of barriers is very important.
Mm-hmm. Doctor, let me quickly take you across the questions posted by our viewers. One of the questions is, if I'm a COVID positive, can I seek medical attention from pre-existing heart conditions?
Yes, of course. Yes, of course. If you have a pre-existing heart condition and you need medical advice, there are two ways of doing it in our hospital. We could do a online video consultation with the doctor, and if required, if your problem is more serious and it demands immediate medical attention, we have special clinics where we can see emergent medical problems.
Mhm. Doctor, one more question. Should I change heart medication or its doses?
No, you should not change any of your medications or doses on your own. Any changes that you make to your medication or prescription is purely based on the advice of your doctor and based on your condition and based on the any change that has occurred in medical condition.
Mm-hmm. Is self-isolation enough for heart patients to prevent COVID-19?
Self-isolation is the most and the only important way, only useful way of preventing getting the infection for heart patients, elderly patients, patients with pre-existing lung disease, and also each one of us who is not really needed to go out and be in a public place. We doctors have no choice. We are there to help patients to get better. But most others who don't have any work in a public space, public essential service, should isolate themselves.
Mm-hmm. Doctor, one more question. I am on a pacemaker and have regular checkups with the doctor. Should I avoid it?
Oh no, if your pacemaker is working fine and you've had a checkup during the last 2 or 3 months, there's absolutely no need for you to go for a checkup immediately in these conditions. And in fact, if you feel any abnormal symptoms, it's also possible for your pacemaker to be checked at your own place. There are systems and gadgets and technologies in place for us to do that. So, and of course, whenever required, you can come for a quick pacemaker check to the hospital. Absolutely no reason for you to worry, and no reason for a patient with pacemaker to find himself or herself more vulnerable because of the existing climate.
Mm-hmm. Doctor, one more question. I have rheumatic heart disease. Can any increase in temperature be rheumatic fever, or should I get tested for COVID-19?
Well, rheumatic heart disease patient having fever could be because of many reasons.
Mm-hmm.
Could be because any infection, COVID infection, could be because of any other kind of infection. It could also be because of rheumatic fever. So of course, if a patient with rheumatic heart disease has fever, he needs to go to his personal physician and get himself evaluated. If there is no physician available, you can go to the ER of any hospital and get some basic tests done. And one important thing I would tell to all patients, all people out there, every fever is not COVID-19. It could be because anything else. So, but if there is fever, one is first isolate yourself. Make sure that you don't get into contact with any other person, even in your own family, your own children, brothers, sisters, especially not parents. So keep away from them and go to a doctor, whoever is available, the nearest doctor, nearest hospital or nursing home that's available for you. Go there, get yourself checked up. And the doctors are the best people to make a proper assessment and decide if you need further testing for COVID.
Mm-hmm. Doctor, one more question. I recently underwent stent replacement. Am I at risk of heart attack due to COVID-19?
Oh no, you don't stand any additional risk of developing a heart attack due to COVID-19, but of course, you need to protect yourself like everybody else from COVID-19. And because you have a pre-existing heart problem, the chance of complications due to COVID is slightly higher. So the best way forward for you is to totally avoid getting the infection. And the only way that we have right now is to isolate, isolate, and isolate.
Okay, and the last question I would like to take. I regularly undergo vaccinations and immunizations. Am I at risk for COVID-19?
No, it doesn't put you at any risk. Whatever your regular vaccinations as recommended by your physician as is part of the standard medical protocol doesn't put you at a higher risk of COVID. And as for COVID, we don't have a vaccine yet. And even if people have taken vaccine for regular flu, there is a regular flu vaccine available. So even if somebody has taken a flu vaccine, that doesn't protect them from the COVID-19. So they have to take the usual precautions. No, if you have taken a vaccine before, you're not at additional risk.
Well, thank you so much, Dr. Rajasekhar, for being here.
Yeah, it's my pleasure. Thank you very much for having me here.
Thank you, sir. That's all we have for now in this live session. Our topic for discussion tomorrow is how to sterilize and pre-use PPE, which is personal protective equipment. Till then, stay home, stay safe, keep smiling. Bye.